Project Search is a program that was developed about 25 years ago at Cincinnati Children's Hospital. The founders, Aaron Riley and Susan Rutkowski, sought to begin a program that would open up workplace opportunities to people with disabilities and develop this magnificent, really well-supported, well-structured program that now exists internationally in 47 states, 400 locations around the world. It's an amazing program that is helping over 2,000 people a year become employed. So the program's designed to help people who are in their final year of high school so that they're in a position to be starting to think about how they're going to live their lives in an adult, independent manner.
I've been really happy since I started working at Jefferson. I feel proud of myself for getting this far. What I like best about my job is my coworkers because they treat me like part of the team.
I met Lainey, I guess at this point it's been maybe 3 years now. So I've known Lainey since she walked through the door, basically.
We loved having her. She would joke with us and she's always willing to help, and that's something that we love about her.
During the program year, they have 3 different internship rotations. The goal of this program is employment, and the employment outcomes are amazing.
I basically reroute patients' referrals so they go to Jefferson doctors.
Lainey is great. We always say that you need it done. Lainey's a machine. She's unbelievable with the computer. You give it to her and she can hyper-focus on it and it's done. And she has such a fresh perspective on things, so we really enjoy working with her.
She was always willing to jump in and the first one to go, hey, yeah, I'll help, no problem. Having some exposure to someone that has just different abilities, really has helped other people learn that, they're no different. It's just because they have special abilities or needs or work differently, it's just like everyone else. We all have our skills and abilities.
My future plans are that I want to become an editor at a publishing house. To prepare for my future goals, I'm going to go to Rowan College at Burlington County for an English major. I'm really happy to be working at Jefferson, to have this opportunity to give back to my community and get job experience. I'm really happy to have this opportunity.
My favorite thing about working in the emergency room is that I get to explore the hospital, learn new things.
The first time I had met Anthony was through the Yale program. Right away I could see the sparkle in his eye and I knew he wanted to be up in the emergency department. At that time he started his internship in the ED. The staff immediately grabbed onto Anthony's energy. He started over a year and a half ago and he's been doing it extremely well. He currently is a supply tech. Anthony just grabbed on immediately to the position.
What I do in the emergency room is that I stock supplies, make sure our oxygen tanks is filled, towers are filled, and sanitize all the medical equipment.
Without Anthony doing this job, we would be relying on techs, which takes them away from other tasks. So his role in making sure the equipment is there is so important. And he knows that. He takes a lot of pride in his work. We knew there was a need for him. We had him working Mondays, Tuesdays, Thursdays, and Fridays, and we actually expanded him to Saturdays because of how well he was doing. So he has been really a benefit to us working in the emergency department. Anthony makes connections with patients because they just naturally talk to Anthony, and they see all that as a bright spot in the emergency department.
What I do, my process is that I introduce myself to patients calmly. One time, one patient was kind of freaking out when I got in his room. He yelled at me, left, came back, I said, "Are you okay?" "Yes." "Are you calm now?" "Yes." I asked him, "Can I get him a drink, a pillow, a blanket, maybe calm down?" "A blanket, please." I got him a blanket, warm one, hand it to him, and calm down. Get back to my work.
Staff are very happy to have him here as part of the team.
In the future, I would like to support my family, and mostly from my mom. And I would like one day to move out on my own. Probably married, maybe. No kids, though. Well, Project Search helped me prepare for his job by teaching me more independence and help me get out in the real world, learn new things, and it helped me out a lot. I say this, Project Search saved my life.
So my favorite part of my job is working in the medical field and being able to interact with people and working with computers and learning new skills and techniques.
Adham is a sweetheart. I mean, he's just the nicest guy you will ever meet. He's always wearing a smile. He kind of reminds me to take the time to do the pleasantries, because sometimes I just go in and I just kind of, okay, we need this, that. He's like, hi, Leslie, how are you today? And he reminds me to slow down.
So my current job at Jefferson Health involves scanning patient charts and photocopying patient documents and printing out patient schedules to determine which files are needed to be scanned for upcoming appointments.
No one in an interview asks you how long it takes you to learn the job. They only ask you if you know how to do the job. And what this program does is give people the gift of time to learn the jobs.
So Adham's role is really critical. He will scan all of the paper charts into the electronic health record so that the doctor has access to all of the prior records. That's a very monumental task, and he does it very well.
What I really enjoy most about Project Search is the diversity of learning opportunities, because we get the chance to work in many different departments to learn the skills and techniques and the varieties of tasks in the medical field. So to help prepare for my future goals, I'm currently taking college courses, and as soon as I finish my general education, I intend to start medical coding courses, hopefully to earn a future position. I'm hoping that I earn a job with the medical coding at an insurance company.
He has a routine where he will go in and pull the charts for the coming days so that those are scanned first. And then when those are done, he'll go back to doing an alphabetical order. We actually kind of have like this inside joke. We call it a hot cake. And I'm like, okay, I got a hot cake for you. He's like, got it. And he knows exactly what to do, and he just scans it right away, and it's all ready to go. He really does it with a smile and is happy to be helpful. He's really doing a great job.
Ever since Project Search, I feel that I've transcended. I've learned so much from the Project Search department. I mean, they've given us this incredible platform in this incredible field, and I'm proud of what I've accomplished ever since the program has ended. So everything that I have done has led me to where I am today, and I couldn't be more prouder.
To see these 3 young people being able to change their lives and change their futures because they've had the opportunity to contribute in a meaningful way. It's truly remarkable to see the difference that this is making in their lives.